This is a report tutorial from Precision Analytical. We have other videos that go into more specific areas of the report, but just as a general overview of the report, what you're going to find on page 1 is an overview of your hormones. You're going to see a total of all your estrogens. You're going to see progesterone here, and that's listed as a serum equivalent. So progesterone in urine is measured by way of metabolites, and I'll show you those in a minute. But on the front page, from the correlation data that we have produced, what we've been able to do is then produce a serum equivalent to make it a little bit more intuitive for people who are used to either serum or saliva testing, where progesterone's a direct measurement. So this is actually a calculated value here, and for any of these you can see the reference range. For women, the premenopausal range is up here, and then the postmenopausal range is that little purple band at the bottom. For all other scenarios where there isn't a pre and a postmenopausal difference, or for men, the reference range is simply up between the stars here. So you can see then testosterone is going to be on the summary page, the total of DHEA production, and then the free cortisol pattern, which is part of the adrenal profile, and then those are added up, which creates this number here, which is just the total of your free cortisol. And of course, that's one of the big differentiators with this test, is we measure the free cortisol, which makes up about 1% of the total, although it's a very important measurement, but also the metabolites of cortisol, which represent a larger fraction of what's actually produced. So in a situation like this, the free cortisol is low, but the overall production is actually elevated. You'll also see on that front page a screenshot of the therapies as reported by the patient on the lower left. On page 2, you'll see just a classic listing of the hormones and their ranges and whether they're within range or not. And then below that, you can see different ranges. If you want to see what's normal for follicular phase or postmenopausal or different phases, you can look there for that. The more specific breakdown of the reproductive hormones and their metabolites can be seen on page 3. There's no number here for progesterone because there really isn't progesterone in urine. As I mentioned before, it has to get turned into pregnadiol first. So half the progesterone goes this way down the beta pathway, half goes down the alpha pathway, and then what we plot here is just a kind of a weighted average of the two. But then if you go back to the summary page, you can see the calculated serum equivalent, which is usually a more intuitive number for people if they're used to other sorts of progesterone testing. As you look at the estrogen, we showed on the summary page the total, but here you can see a more detailed breakdown of E1, E2. So this is your most potent, your parent hormone that your ovaries make, and then you've got all these different metabolites. When we talk about phase 1 metabolism, that's looking at which of these 3 pathways is preferred in terms of metabolism. So you can look at those. You can also look at those as ratios. If you look over here, you can see what's normal is 70% of these 3 metabolites is a 2-hydroxy, 10% is 4, and 20% is 16. This particular patient's results then show here, so you can see the 2-hydroxy is less than 50% instead of the expected 70%, so the estrogen's not going as much down this particular pathway. So you can evaluate that. Generally, people are hoping that the 2-hydroxy was really predominating because it's thought to be associated with more protective properties as opposed to the other 2 metabolites. Then we can also look at part of that's phase 1 metabolism. Phase 2 includes methylation, where we're turning this hydroxy, 2-OH, into the 2-methoxy. Usually in females, the 2-methoxy is around half. So we're looking at the ratio of those, and what this index says is when I look at the ratio for this particular patient, it's lower than usual, which means they're not doing a lot of methylation. It's not showing good methylation relative to what people typically show. When we look at DHEA and the androgens here, you can see DHEAS. That's one metabolite. If you test in blood or saliva, that's probably all you'll get. When you look in urine, you can measure these 2 metabolites, and if you see how big these numbers are, they represent a large portion of the overall DHEA. So then to look at the total of DHEA, we just add those 3 up and list that as a separate measurement we call total DHEA production. You can see the age-dependent ranges because DHEA tends to drop quite a bit with age. The other thing that we can see here is if you have concern about high androgen or testosterone or male-like symptoms of increased facial hair, increased thinning scalp hair, in males, prostate issues, thinning scalp hair. DHT is your most potent androgen, and it can be a reason for those things. To evaluate that, we look to see if there is activity with this enzyme 5-alpha that makes DHT. So to look at that, we look at the 5-alpha metabolites versus the 5-beta and just look and see who's winning this battle. In this case, it's heavy down the 5-alpha pathway, which would then imply that at a tissue level, let's say in a hair follicle, testosterone's going to move to DHT fairly readily, and that's something that you can address. So that's what that section is for. And then we've got a more detailed breakdown of the adrenal hormones on page 5. We're going to show melatonin if that's ordered. These two have already been shown on page 1. When you want to look at catabolic versus anabolic, these are anabolic, and the cortisol's your catabolism, it's catabolic. So sometimes doctors like to look at those and see which one's predominating. Then we can see again what we saw on the first page is the free cortisol pattern. We can also see the inactive form, free cortisone. So in this case, it's a little bit higher. And then when we move down further, we can see that just the totals of those 4, but then also which metabolites do we have more of? What scientific literature would suggest that if we want to know if cortisol is more in its active form or in its inactive form, it says look at the metabolites. Do you have more cortisone or more cortisol metabolites? Well, in this case, there are more cortisone metabolites, which means there is a lot of deactivation of cortisol to cortisone, which is probably why this cortisone pattern is a little bit higher than the cortisol. So in a situation like this, that's something that your doctor can address if there's issues both with the free cortisol or with the production levels, which is measured by the cortisol metabolites. Or is there a metabolism issue? You can evaluate all those things by looking at the test. So hopefully that's a helpful introduction to how to read and interpret the test. Again, there are other videos at dutchtest.com in the video library that you can find that speak to more specific issues, and you can always call or email the lab if you have additional questions. If you're a patient and you have additional questions on interpretation or any treatment, please do send those questions back to your healthcare provider, and we thank you very much for working with us.